friends, welcome back to my channel once again, Dentlearning. Today we are going to learn a very important topic, that is nothing but impaction from oral surgery. So let's get started without getting any further delay. Before getting started, make sure you subscribe to my channel and hit the bell icon so that you can receive the notifications as soon as I upload my new video. So this is nothing but the definition. Okay, definition is very important and you have to remember it as it is. Definition, I will explain you. Just look at this picture. A tooth is said to be impacted when its path of eruption. This is nothing but the path of eruption of the mandibular third molar. This path of eruption is obstructed by the presence of either a soft tissue or a bone or the other tooth. Okay. This is the second molar, this is the third molar. If the path of eruption of the third molar is obstructed by any tissue or bone or the adjacent teeth, then it is known as the impacted teeth. So, moving to the definition, a tooth is said to be impacted when its path of eruption into the occlusal plane is obstructed by the presence of a tooth, bone or soft tissue, so that its further eruption is unlikely. This is nothing but the definition. You have to remember it. See, you can see here, this is the third molar, this is the second molar. This path of eruption is nothing but this is the path of eruption of the normal mandibular third molar. Okay, but the teeth is here angulated. Okay, this is the angulation. Okay, so this teeth, the eruption of the third molar is obstructed by the second molar, nothing but the teeth and also the tissue and also the bone. Hence, it is nothing but the impacted tooth. Here, there are a lot of classifications given about impactions. We will be learning two very important classifications in this video with as early as possible. So here is nothing but a mandibular third molar is classified into mesoangular impaction, horizontal impaction, vertical impaction, distoangular impaction. These impactions, these different names are given only because of the position of the impacted third molar. See, you can see here the crown part is tilted mesially towards the second molar. See here, this is nothing but the second molar. Here is your third molar. Okay. This crown part, I'll take different color so that you can. This crown part is tilted mesially. Okay. Tilted mesially. This mesially. This is the long axis of the third molar. This is the long axis of the second molar. Hence, this crown part is tilted mesially. This angulation formed by these two long axis of these two teeth is nothing but mesoangular impaction. We will call it as mesoangular impaction. Same thing if this is nothing but second molar and this is your third molar. Okay, so here this is the long axis of second molar, this is the long axis of the third molar. The angulation made by the distal tilt of the crown of the third molar, this form of impaction is nothing but the distoangular impaction. You can see here I have covered this mesoangular impaction. The crown part is tilted mesially. Okay, and this forms an angle with an second molar. And distoangular impaction, here you can see this is the long axis of the second molar, this is the long axis of the third molar. This angulation formed due to the tilt of the mandibular third molar crown towards distally. Okay, this tilt is distally. And now vertical impaction is nothing but the long axis of the second molar is parallel to that of the long axis of the third molar. But this impaction may be due to the soft tissue or due to the bone. Okay, this vertical impaction is not that kind of impaction which is the path of the eruption is not obstructed by the other tooth here. Okay, this is nothing but the long axis of the second molar and third molar are parallel to each other. Hence, this is nothing but the vertical impaction. Horizontal impaction is said that the severe mesial tilt of the third molar is considered to be as the horizontal impaction. Here, this is the second molar and this is the third molar. Okay. So you can see severe mesial tilt of the third molar leading to the perpendicular angulation formed by the long axis of two teeth. This is nothing but the horizontal impaction. Here, these are the radiographs which show this is nothing but the mesoangular impaction. This is nothing but the mesoangular impaction. Okay, this is the angle formed due to the mesial tilt of the crown. This is nothing but the perpendicular one. This is the horizontal impaction. Okay, and this is nothing but the vertical impaction. The long axis of both the teeth are parallel to each other. Okay, and here this is the long axis of the second molar. This is the long axis of the third molar. This is formed due to the distal tilt of the third molar. Hence, this is nothing but the distoangular impaction. This classification is called as Winter's classification. It also includes three more categories, that is inverted. Okay, mesoangular impaction, horizontal impaction, vertical impaction, inverted, transverse, and two more, that is which is where the teeth is placed more buccally, and in the other one the teeth is placed more lingually. Okay, this covers all the Winter's classification. And now moving towards the other pictures, we show you the clearly this see here you can see that. So this is first picture show you the horizontal impaction, the severe mesial tilt of the mandibular third molar leading to an perpendicular angulation of the long axis of the two teeth. This is nothing but the horizontal impaction. And this is the vertical impaction where both the teeth long axis are parallel to each other, and this obstruction is due to either the soft tissue or the bony part. Okay, and here it is the mesoangular impaction. This is the mesial tilt of the third molar which forms an angle with the long axis of the second molar. And here this is the distoangular impaction. It is given clearly here. This is the angle formed due to the distal tilt of the third molar. Okay. And here we see one more. This is nothing but inverted. This is also included in the Winter's classification. These are the clear pictures. You can appreciate it and remember it clearly. What is what? This is the vertical impaction, horizontal impaction, mesoangular, distoangular, inverted. Now moving towards the another classification that is also very easy, and it is better that you remember two or more classifications so that you can write in your exams and fetch more marks. So this previously we learned Winter classification. This is Kelly and K classification. So it has categorized into three categories based on the angulation and position, based on the state of eruption, based on roots. Okay, so based on the angulation and position, this is same as that of the Winter's classification. So you need not to remember other thing. Same you have to write the Winter classification which we have learned in our previous slides. And now moving towards the based on the state of eruption. So based on the state of eruption, it is classified into completely erupted, partially erupted, unerupted, or it is also called as embedded. Okay, embedded. So completely erupted, partially erupted, unerupted, or embedded. Okay. Now, based on the roots, it is classified into number of roots. Number of roots are, that is fused roots, two roots, multiple roots. And based on the root pattern, surgically favorable, surgically unfavorable. This classification, it is also easy, and remember it so that you can fetch more marks. So I hope this video is helpful for you. So please keep learning with Dentlearning and like my videos. Do not forget to subscribe and share with your friends. Until then, stay tuned. Bye bye.